A recent study from Indeed shows over half of the U.S. workforce is feeling burned out, and 67% say burnout has worsened during the pandemic. Some of the stressors include social disconnectedness, health and job concerns, childcare strain, social injustice, and uncertainty about the future. A recent Gallup poll shows the percentage of Americans who evaluated their lives as thriving in 2020 reached the lowest levels since the Great Recession of 2008. And experts say the negative mental health effects of the past year could last beyond the pandemic. For more on this, I want to bring in Dr. Jessie Gold. She is a psychiatrist and assistant professor of psychiatry at Washington University in St. Louis. Dr. Gold, welcome. Thanks very much for being with us. What are some symptoms of burnout, and what should people do to cope with burnout if they're experiencing it?
Burnout's one of those things that everybody has a different definition of, but when you kind of look at the research, the most common things that people experience are emotional exhaustion, which is like at the end of the workday, you're just really tired emotionally, and sometimes that looks like physical exhaustion too. Depersonalization, so sort of just becoming callous about things, and then this sense of reduced personal accomplishment, so you don't feel like you are effective, you don't feel like you're getting value out of your work. Those are the most common things you experience when you feel burnt out. It kind of varies between people, and it can be totally subjective, and I think people have different signs of burnout for themselves. Like for me, it's like if I get angry at emails, that's a pretty good indicator that I'm burned out, but it kind of depends on who you're talking to.
Yeah, emails do it for me too. I don't know what that is. But a poll taken earlier this year, doctor, shows that more women reported feeling burned out than men. Why might women be experiencing burnout at a higher rate during the pandemic?
There are so many additional stressors for women right now. I mean, we bear the brunt of childcare. Just it is the way that it is. People come home and they're teaching their kids at school at home as well. I think that's an additional stressor that people didn't assume that they would have at home. So you're maybe coming home from a job, or you're doing your job at home, and then you have your kids, you have the house responsibilities. If you don't have kids, you also just are bearing other responsibilities. So I just think that that tends to be one of the reasons why women have more burnout, more stress.
Workplace burnout is reportedly even worse for women of color. Dr. Gold, why is that?
I mean, look at this country. Every single day, there's something in the news that if I was a person of color, I would be stressed or dealing with some sort of repercussion as a result of. I mean, it's hard for me to speak to as a white person, but my patients of color have definitely been having additional stressors. The people that I talk to who are therapists of color have been having additional stressors this year. There's absolutely so many things that, the pandemic's disproportionately been affecting people of color. There's the racial injustice. It's just, I can't imagine this not disproportionately affecting people of color.
Well, a recent Gallup poll shows worry and stress have been higher for remote workers than for on-site workers. Why might that be the case?
I mean, I don't know if you changed your work from being in person to being remote, but for me, I went from seeing patients in person to seeing patients completely on a computer. And man, is it way, way harder. I think if you sit in front of a computer all day, it just has this different sense by the end of the day that you're just exhausted and there's no real sense for why. And every day at the end of the day, you just want to go to sleep. And I think that that's what I've been hearing from people. It's really different. It's physically exhausting. It's emotionally exhausting. A lot of the feedback you get from being at work comes from seeing people. People like being social, even if they're introverts. There is a part of them that really enjoys being around people. And we just haven't had a lot of those interactions, like even the small ones, like going to the mailbox or walking down the hallway and going to the bathroom and just running into people. So we just have a lot less interactions in general with human beings. And I think that makes it much more easy to burn out.
Yeah, it is remarkable how much you miss those interactions and how much you don't. I never realized how many of those you have over the course of the day until the pandemic, when we just didn't have them at all. So it is such a noticeable difference. I want to ask you about another group of workers. Many healthcare and frontline workers are experiencing a different type of burnout. and in many cases PTSD. Explain the unique psychological impact the pandemic is having on these workers and what can they do to cope?
Yeah, I mean, one of the populations I see in my clinic is healthcare workers. This pandemic has been tremendously hard on them. I mean, the workplace shifted, what they see day to day shifted. I think people who are in healthcare are used to seeing hard things. They're used to seeing people die, but they're not used to seeing people die at this rate. They're not used to having the inability to save them. They're not used to having the ability to get sick from the workplace. And there are lots of healthcare workers who have been sick or who have died or who have seen their coworkers get sick. All of those are additional stressors that people have experienced in the workplace that, has led to different things like anxiety or depression or trauma. And I think, healthcare workers are human beings too. So they come home and they have those same stressors as women. They have those same stressors as people of color. And they are, existing in the world just the same. So they have the healthcare stressors and the rest of the stressors as well. And I think that is an additional problem. And, what can they do? It's really hard because they have to still go to work every day. I think we have to be able to check in with ourselves and say, how does this affect me? And I'm a human too. So what are my feelings? How am I feeling? Do I need to get help for this? And I think healthcare workers tend not to do that and tend to do a lot of caring for other people before they care for themselves. And we need to, step back and say, we can't care for other people that well if we're not caring for ourselves, and we have to go get help if we need it. So we do need to do those check-ins for ourselves. We do need to figure out what coping mechanisms work for us, and we do need to get therapy and mental health help, even though it's really stigmatized in healthcare, because it is needed.
Well, finally, Dr. Gold, how might widespread burnout impact companies and businesses, and what can employers do to help?
Yeah, I mean, the data on this, at least in healthcare, is pretty significant. People leave the workplace, people leave the workplace at high numbers. It costs tremendous amount of money to train people and then have them leave. So it's a high cost to a workplace to have people leave. So, in patient care, it also has a significant impact on, satisfaction of patients, errors for patients, things like that. So it's not just affecting the worker themselves, it's affecting the outcomes of their work. All of that is affected by burnout. So if you're a healthcare system or any other employer, it's very clear that burnout is important, that things you need to do are actually value the mental health of your, workforce, which means investing in it and investing it in a long term and not just a Band-Aid solution saying, okay, it's the pandemic, they're sad, they're stressed, it's a pandemic and it's going to end when the pandemic ends, or we vaccinate everybody and we're fine and we can go back to the way things were. Mental health is one of those things that is going to be much worse when the pandemic is over and people get back to work and it's not the same as it was, or they have a chance to actually check in with themselves and realize that they aren't the same, or they did have things that affected them and they do need help. So workplaces really need to, provide resources, provide funding, provide access, whatever they need to be doing to really value mental health just as same as they do physical health of their employees, and for the long term is really necessary.
It's such a critical message. Dr. Jessie Gold. Dr. Gold, really great to have your insight. Thank you very much.
Thank you for having me.